Healthcare is becoming increasingly complex, not to mention costly. Health researchers are engaged in finding solutions to these challenges, exploring new ideas to support patients in being more active participants in their healthcare journeys, to make healthcare services more efficient, and to try and reduce costs. The Saskatchewan Health Research Foundation supports scientists in discovery and innovation so that we can all live our healthiest lives. We have received funding for two SHERF projects and are currently working on both a Collaborative Innovation Development Grant, otherwise known as a CID, and a SHERF Establishment Grant. Let's look at the CID project first. Collaboration inspires innovation. This project team is led by nurse researchers with pediatric and medical surgical backgrounds, including expertise in inflammatory bowel disease. Add in a computer scientist, an adult gastroenterologist, and expert patient partners, and you have a CID team. Our innovation is exploring how technology, specifically a mobile application, can support patients living with IBD as they move from pediatric to adult care. This move is typically called healthcare transition, and patients with many kinds of chronic conditions can suffer poor outcomes during this time. When patients struggle in transition, there can be costly results, with longer hospital stays and more aggressive treatments needed. Patients have questions during healthcare transition about managing complex self-care, keeping track of symptoms, tests, appointments, and of course, medications. A targeted mobile application can provide resources, improve care management, and serve as a communication tool between patients and family caregivers during transition, helping everyone move into their new roles. Our SHERF Establishment project on patient empowerment features a patient as an active co-investigator. With additional expertise from nursing and a specialist in instrument development, this team is set to explore how Saskatchewan patients define empowerment in today's digital health landscape. Patient empowerment is a complex concept, and health researchers and others have used patient engagement and activation interchangeably with empowerment, creating some ongoing conceptual confusion. After working with Saskatchewan patients to better define empowerment, we will create a new measure or tool and do extensive testing to establish its reliability. Then, in partnership with eHealth Saskatchewan, we will use the tool with patients accessing their health information electronically through a patient portal. We know that increased feelings of empowerment can influence patient outcomes, but a more accurate measure is urgently needed, especially when it comes to technology interventions. Collaborating with patients and using technology to improve health outcomes is how we do research that matters.